Good evening, everyone. Today we are going to discuss bones of the skull or cranium. Now, the cranium or skull is divided into two parts for our convenient study, which is facial skeleton. We can see this is facial skeleton, and this is the brain box. This is brain box because it holds the brain, so we will call it as a brain box. Now coming to the brain box or cranium, bones of the cranium, there are 14 bones in the cranium which are divided into paired or unpaired bones. Now coming to the paired bones, there are two parietal bones in the skull. We can see one on each side, and two temporal bones which are present on the side of the skull. We can see this is the temporal bone, this side, and this side also we can see the temporal bone. Two parietal bones, two temporal bones, and malleus incus stapes are present in the ear bones are called as malleus incus stapes, which are present in the temporal bone. That is also called as a bones in bone. So now coming to the what are the unpaired bones? Unpaired bones they are single in number. They are single in number. So we will call it as a unpaired number. What are the unpaired number? One unpaired bones. The frontal bone, which is one in the skull, and occipital bone, which is one, and we can see the sphenoid bone, and another one is ethmoid bone. They are single or one in number, so we will call it as a unpaired bones. Now coming to the discussion of bones of the facial skeleton. The facial skeleton bones are divided into paired bones and unpaired bones. There are total 14 bones in the facial skeleton. In that, 12 are paired bones and 2 are unpaired bones. Now coming to the paired bones. The paired bones are two maxilla. There are two maxilla and two nasal bone. We can see there are two nasal bones and two maxilla, two nasal bones, two zygomatic bones, and two inferior nasal concha. We can see this is the inferior nasal concha which are situated, and two palatine bones. We can see the two palatine bones also, and lacrimal bones. We can see the lacrimal bones here. You can see inside there is a two lacrimal bones. And now coming to the unpaired bones. The unpaired bones of the facial skeleton are, one is mandible. You can see this is the mandible comes under facial skeleton. This is the unpaired bone, and another one is femur bone. We can see this is the femur bone. Total 14 bones. Now we will discuss about the types of the suture. We can see here the internasal suture. Internasal suture is type of plain suture, and we can see this is the coronal suture is in a pattern of serrated pattern, and we can see the lambdoid suture is in a denticulate pattern. We can see it's like tooth like, that's why it's called as a denticulate pattern. And coming to the squamous or peritomastoid suture, there are four types of the sutures. Especially in the skull, there are four forms of the suture. Now coming to the ossification of the bones. The frontal and parietal bones and the part of the occipital bones are ossified by the intramembranous process, which is a quick one-stage process. And coming to the base of the skull is a two-stage process, that is intramembranous, cartilage, and bone, which is a two-stage process. And now coming to the how to read the skull. Because of there are many bones in the skull, it's hard to study. So for our convenience reading, we divided into many parts like norma verticalis. The superior part is also called as a norma verticalis, and the side of the skull is called as norma lateralis, and the anterior part, and it is also called as the norma frontalis, and this is the norma occipitalis, and this is the norma basalis. I will tell once again, this is the norma verticalis, this is norma frontalis, and this is the norma lateralis, and this is the norma occipitalis, and this is the norma basalis.